tell you what, good evening. Thank you for being here tonight for this important COVID-19 update. Tonight I'm grateful that Dr. Tony Slonim, the President and Chief Executive Officer at Renown Health, could be here with me to share the very real burden that COVID-19 is having on our communities. You will hear from him shortly. As you are all aware, our country and states are on a very rough course right now when it comes to the coronavirus and its trajectory. New cases, hospitalizations, and tragically fatalities are on the rise. The fall spike predicted by all medical and scientific experts is now our reality. Nevadans need to accept and understand this reality now and change behaviors immediately. I'm encouraged by this week's news about a potential COVID-19 vaccine. It gives me hope, and it should give you hope. Our Nevada team is closely monitoring these updates and adjusting our vaccine distribution framework so we are ready when the time comes. But an accessible vaccine isn't ready today. It won't be ready tomorrow, and it won't be ready next week. And based on our current case numbers, we can't wait for a vaccine to get this deadly virus back into a manageable level. We don't have much time to act to avoid a dangerous hospital surge and keep our economy going and keep people at work. We're walking a tightrope between maintaining faith services, commerce, and recreational activity, and protecting lives, our public safety frontline workers, and our healthcare infrastructure. We all must act right now to keep our economy open and eventually begin to restore other parts of our life, like schools, family gatherings, and entertainment venues. But, and this is very important, in the next 2 weeks, we must see a significant reversal of the current trends, which are deeply concerning now. There were more than 1,300 new cases identified yesterday, more than 8,000 new tests, and unfortunately, 7 additional deaths. Our 14-day positivity rate is an astounding 13.7%. It's continuing to climb. For the most recent 7-day period, cases are growing at a rate of 1.2%, or 1,326 new cases per day. 1,326 new cases per day. The Nevada Hospital Association reports that Nevada continues the upward trajectory of COVID-19 cases as the population appears to have disengaged from mitigation steps such as social distancing and remote working. Monday marked the highest recorded number of hospitalizations since mid-August, effectively erasing the progress made over the past 3 months. To preserve our state's economy, we must refocus on preventing the spread of COVID-19. We have to go back to the basics, which by now are pretty common knowledge. Wearing masks, maintaining social distancing of at least 6 feet, and limiting the risk of exposure, and washing your hands are the only ways we can keep going in the right direction. The only proven way to control the current widespread transmission of COVID is to decrease mobility. That means staying home as much as we possibly can. Thus, we have Stay at Home 2.0. As a result, for the next 2 weeks, Nevadans need to operate in a stay-at-home 2.0 mentality to get things under control so our public health response infrastructure can catch up. We need that time to bring testing timelines down, catch up on contact tracing, and relieve our healthcare infrastructure system. We need swift action to change our behaviors so we can see a downward trajectory at the end of this 14-day period. If you don't have to go out, don't go out. Reduce your time in public to what is necessary and limit any and all exposures to those outside of your household. Think about changes like ordering groceries for delivery instead of going into the store, or picking up dinner outside, curbside, from your favorite restaurant instead of sitting indoors with others who are not members of your family. Avoid gatherings, large and small. Our businesses are doing what they can to keep employees and customers safe, but we need those employees to practice all public health measures at home and as well as in the restaurants and businesses. Do not have people outside of your household over for dinners, parties, or other gatherings. Connect over Zoom or on the phone. I know this is an enormous sacrifice for many people, but it's what needs to be done to stop the spread of this virus. We know from experience that temporarily decreasing our activity in the community can significantly reduce the spread of COVID-19 and reduce the burden on our healthcare system. In March, when we first implemented stay-at-home orders, much of Nevada was closed, including many of our key industries. This action was necessary, and it was taken to avoid overwhelming our healthcare facilities and to reduce COVID-19 related fatalities. While the stay-at-home measures worked to flatten the curve, they also led to a detrimental economic and social impacts that will take time to recover from. Back in the spring, we did not have the experience or the data to guide our decisions, and instead had to rely on models and projections. We know more now. We believe that we can safely reduce the spread of COVID in our communities without requiring closing sectors of our economy. But to do this, we are asking each and every Nevadan to do your part in slowing the spread of COVID and protecting our most vulnerable. I know you've heard me say all of this before, but I'm asking you on behalf of our healthcare workers, our EMTs, and everyone on the front lines who is seeing this alarming trend in the wrong direction, please, please do your part. If we can take action now, we can keep our businesses open and reduce the spread of COVID, save lives, and keep our healthcare system from being overwhelmed. As government officials, we can only adopt and enforce restrictions in businesses and public spaces. What you do at home, in your own backyard or your neighborhood, is almost more important. Please don't let your guard down at home. So we've got some specifics for you. For all employers and office spaces, we're asking that you telework as much as possible. If employees can do their jobs from home, have them do so for the next 2 weeks. If employees have to be in the workspace, they need to be masked at all times, and meetings should be done virtually from individual offices instead of in conference rooms or shared spaces. For commercial and government employers, this is not the time to encourage or even allow crowded meetings in indoor events, like birthday parties or retirement parties. Masks must be worn by everyone in meetings of 2 people or more for the entire duration of the meeting. Keep the number of people in meetings to a bare minimum, and keep the meetings short. I will be directing all state employees to adhere to these common sense practices and encourage all local governments to follow. To the private sector, follow our lead and help protect your businesses and employees. Faith leaders and places of worship, please review and remind the faithful of all safety protocols. We've witnessed in other parts of the country significant spread from wedding celebrations, celebrations of life, and other church gatherings. From synagogues to mosques to churches and chapels, please take all necessary measures so we can continue to worship. Sometimes these are done unknowingly. People get out of a mass or service and they congregate in the courtyard and they catch up and they talk and they spend time with each other. We're asking for 2 weeks to stop that practice, to please leave the service and get in your car and go home. Local government and enforcement. I know the majority of our businesses are doing a great job, but for those that aren't, you are threatening Nevada's economy in this critical moment. I do not want every business to suffer with closures because a small few refuse to follow the protocols. So for the next 2 weeks, we implore every business to follow the protocols that have been put in place. That's why I am asking local governments to step up enforcement measures over the next 2 weeks to ensure all businesses are doing their part. This includes citations, fines, and potential license suspensions. I'm asking the local governments to coordinate their efforts between themselves to help each other coordinate and educate and enforce. And I'm calling on our universities and our colleges to do more. I'm asking you to step up, communicate with your students, communicate with your faculty, and avoid any gatherings on any campuses and in their homes. Get the message out to all of your students. We've got 2 major airports in Nevada, and I've been in both of them in the last week. The compliance is beginning to fall short. People are taking their masks off when they get off the plane. They're wearing them under their nose or on their chin. So for everyone's sake, understand, while you are in one of the airports, it is mandatory that you wear a mask at all times, unless you're eating and drinking, and for that moment, you can have the mask off. But while you are in the airport, it is a mandatory issue that you wear your mask, and I'm asking both airports to step up enforcement of mask wearing. For the next 2 weeks, we must mimic our stay-at-home behaviors from this past spring. If we do so, we believe we can begin to turn around things in 2 weeks without having to place increased restrictions on our businesses or our schools. We do not want to do that. I do not want to do that. We have a chance to avoid that from happening if we all help and we all pitch in. If we don't turn things around, cases will continue to grow out of control, hospitalizations will continue to increase, and ultimately overwhelm our hospitals. Hospitalizations will increase and overwhelm our hospitals. Medical staff and first responders will continue to have increased risk of exposure, resulting in staff shortages across our state. We cannot afford that nightmare scenario. But we have 2 weeks to do it, and it will take every one of us to do their part. Again, if we don't come together at this moment, I will be forced to take stronger action in 14 days. To be clear, I don't want to take stronger action. I do not want to implement more restrictions. I want this to improve, and we can make it improve if everyone helps. I want to stay on the path to get all Nevada children back in classrooms, opening conventions by 50% by January 1st, and lifting more restrictions. That's the path I've laid out for Nevada. We need to decide if we want to remain on it. I want all of our kids to go back to school, but I want them to go back safely. Our students are suffering from mental health issues. I spoke to the Clark County superintendent this afternoon, and we lost another student to suicide this week. That's not acceptable, and it's something that we can all do our part to prevent from happening. Some people are going to ask, why not limit retail, our casino resorts, our restaurants right now? That's a fair question. That's a tightrope I was referring to. That is a tightrope of trying to balance controlling the COVID spread, protecting our hospitals from surges, and at the same time not destroying and shutting down our economy. I want to make every effort. I want us to make every effort to keep people on their jobs and to keep our economy moving forward. Additionally, those businesses under scrutiny from OSHA, local authorities, gaming regulators, and others will see an increased enforcement in those businesses and an increase in violations and fines if people are not complying. They are monitored for noncompliance with mitigation protocols, and they will be fined for noncompliance when standards are not met. Additionally, I've been asking the various businesses and their associations to step up their in-house and back-of-house communications with their employees, asking them to follow our protocols in the workplace and in the community and when they go home. This is common sense. If you're in a carpool with 4 people that don't live in your household, wear a mask when you're in the car. I mean, wear a mask at all times when it's at all possible. Additionally, there may be a perception of a double standard here, but managing through this pandemic, protecting your health and your jobs is a daily challenge. And the only way we can get to the other side of this for all of us is to fight this horrible virus together. While we might be getting COVID fatigue, the virus is not getting infection fatigue. We need to do more. Properly wear your masks in any public setting, indoors and outside. Okay, and I'm going to make this real simple. Properly wearing your mask means covering your mouth and your nose. Wearing it on your ear or your chin or under your nose is not properly wearing your mask. Properly wearing your mask means your nose and your mouth are completely covered. Avoid hosting meetings, parties, or crowded events in small indoor places. Maintain distance of at least 6 feet and limit close contact with people, even if you're wearing a mask. Wash your hands often. And please, stay home if you have any flu-like symptoms. If you're not feeling well, if you have aches, if you have a temperature, stay home. Activate the COVID-19 Trace app on your phone. It makes tracing exposures much more practical, much more convenient, and much more rapid than having to do it by hand. Please sign up and activate the COVID Trace app. At this time, I'd like to turn it over to Dr. Tony Slonim to give Nevadans some in-depth insight into what he is seeing throughout the renowned health network and what that means for Nevadans if we don't take steps to change this trajectory. Dr. Slonim.
Thank you, Governor Sisolak. And thanks to the many, many first responders, physicians, and healthcare workers of all disciplines throughout the state who are doing their part to address the needs of Nevadans. As an ICU physician, a public health professional, and a CEO of a health system that cares for hundreds of thousands of people, I want to ask all Nevadans to stay at home for the next 14 days and please follow the CDC guidelines to reduce the spread of this virus. You see, apart from my professional roles, I also happen to be the son of a great man who died from COVID back in April. And it was a devastating event. And I think we can do more as we try to stomp out this terrible disease. But we need your help. For the first time in the last 9 months, people are being hospitalized and dying at higher rates than ever before. I am very, very concerned. This is new. For those that know me, they know I've not had the same level of concern previously, which is why I'm speaking out now, and why with our sister hospitals in Northern Nevada, our city, our county, and our state, we need to better coordinate our efforts to assure an adequate public health response. We're unable to keep pace with the virus in the way it's currently presenting itself in our community. You can help us. Our first responders, doctors, nurses, and healthcare workers are doing an amazing job every single day. But we're working around the clock to provide care that is becoming increasingly difficult. This past weekend, in order to meet the urgent needs of our community, we rushed to open new units and changed our staffing models. This week, we're planning to open our alternate care site in our parking garage to accommodate an additional 1,600 beds. Right now, we're benefited by the fact that we've got ample PPE, supplies, and equipment, but the more people who get sick, the more we will need to address their needs. As a member of our community, I'm asking you to please do the right thing. Stay home, wear a mask, wash your hands. When you stay home, you protect our healthcare heroes on the front line, you protect yourself and your family, and you save a hospital bed for someone who may really, really need it. Thank you. Back to you, Governor.
Thank you. With that, I'd be happy to, or Dr. Solomon, I'm happy to take some questions.
I think we have a microphone set up over there, so if you guys could go up 6 feet apart of that mic if you have questions.
Hi, Governor.
How are you?
Good. Thanks for doing this. So on October 20th, you said the trajectory was alarming, but the future depended on residents. On the 29th, you said we're not rounding the corner, and if we don't change course, trade-offs will be necessary. It's November 10th, and the message feels similar. You don't believe we need closures to curb the spread of the virus, and are imploring people to change behaviors without state-level action. Why do you think this time imploring residents is going to work differently than it appears to have worked the last 2 times?
I don't want, and you're right, I've been delivering the same message here for weeks, months. Understand, I do not want to close businesses or implement more restrictions. And I don't think we need to if everyone cooperates. But unfortunately, there are some folks that choose to make light of this on social media. There's some folks that are bloggers or columnists that make light of the idea. And I'm asking them, take a break for 2 weeks. Let it go. I mean, I'll be here to criticize 2 weeks from now. But I'm asking them for 2 weeks to please let it go and try to encourage people to wear a mask. And just give it a chance and see if it works. I have confidence in the citizens, the residents of the state of Nevada. I have confidence in our elected officials, and I have confidence in our businesses. I don't want them all to suffer. So we're giving it one last try to see if we can get this under control in 2 weeks, starting right now.
So today at the Economic Forum, the Nevada Resort Association mentioned that kind of threshold that you dangled a few weeks ago about returning to 50% convention capacity by January. For people confused about the trends that you're outlining and the underlying ideas behind that goal, what does your team's best case scenario look like over the next 2 months, and is it realistic?
It's very realistic. I think there's a lot of good things in our future. There are possibilities coming along. If we can get a handle on this virus this time and the spread of this, the infections, the hospitalizations, and ultimately the deaths, I think we can start that trajectory back coming downward. I don't want to lose those conventions. Aren't just people coming here. There are people that are spending money here. There's jobs that are being created here, and we can get our economy back to moving again. But that's not my call. That's each and every one of your call to make if you're willing to cooperate and pitch in and help us out here. I'm not asking for the world. 14 days is what I'm asking for. Please. And I know people criticize wearing masks and they protest and they go back and forth. Give it a break. Give it a rest for 14 days to see if we can try to get a handle on this, because I believe the citizens, residents of Nevada can do that.
Thanks.
Hi, Governor. Wanted to ask, 14 days from now is going to put us at the Tuesday before Thanksgiving. What kind of restrictions are you considering to put in place before then? Are you ready to kind of put those additional tightening of restrictions in place so close to that holiday?
I'm willing to put the restrictions in place only if we're forced to do that. I mean, I'm not bluffing. I'm not playing a game. This isn't just because I want to see all you here tonight that we're having a press conference. We are in a very crucial point right now. I've got doctors who I have an enormous amount of respect for telling me, and scientists telling me, that we are on the verge of being overwhelmed. I don't know what we will have to decide in 14 days. I'm hopeful that in 14 days I'm going to be standing for you saying the people in Nevada came through again. They did what I knew they could do. They pulled together, and we're on the right track. I don't want to think what's going to happen in 14 days if we don't, because what we're facing is a very difficult situation, Riley. Dr. Slonim, he lost his father to COVID. I talk to people on a regular basis that lose a family member, that lose a loved one, that themselves are infected. And sometimes it's not until you are infected that they get the realization of how serious this is. But, one person takes it home and suddenly the husband and, 4 kids got it. And, one gives the grandson, gives it to the mother, gives it to the sister, gives it to the father, the grandparent. It spreads so quickly. We need to do more. And I am confident that if we really buckle down hard for 2 weeks, we can make an inroad.
Governor, you mentioned you spoke to the superintendent of the Clark County School District. Do you support their plan for reopening they released yesterday? Is that something that you think is a good step to take at this point?
I have not read the plan. I know it's 200 plus pages, and I'll try to get to reading the plan. I have talked to Dr. Jara. I am very concerned about getting our kids back in the classroom. I understand we need to make sure that it's done in a safe manner. But as I told you, I think you told me it was a 9-year-old that we lost this week that committed suicide. It's too much. It's gone too far. We need to give kids a chance. We need to have that outlet in school. I'm confident that they can do it safely, and that's not my area. That's our superintendent, our state superintendent. Joan Ebert has done an incredible job working with the school districts. The one we still don't have any in-class time is Clark, and we're working to make that happen.
If the current statistics and trajectory of COVID continues the way it does, do you think that Clark County School District, other school districts should step away from in-person learning?
Well, Riley, if it continues to increase as it's going now, I don't know what restrictions we're going to have to put in place, but they're going to be severe, they're going to be hard, and they're going to be things that people aren't going to want to do, and I get that. But we don't have to do any of that. I don't want to focus on what we're going to do if this doesn't work, because I do believe this will work if we get everybody to pitch in.
Cool.
Hi, Governor. I'm going to belabor the point. We're 9 months into this pandemic, and we're still having debates in the public about wearing masks. Why isn't it wishful thinking to think that every importuning is going to change this time? Well, it hasn't worked over the months we've been going through this.
Bill, that's a great question. I've been asking for a long, long time to wear a mask. I get people protesting in front of the Capitol. They protest in front of my house, both in the north and in the south, that I'm taking away their liberties. I do not know why people, we're not in campaign season anymore here. This is not a political statement. This mask is worn to protect me and my loved ones, and to protect others that I am near. That's what this mask is for. I mean, we're not asking somebody to, do something that is extremely onerous. And I know people are going to criticize me for saying, please wear a mask. They're going to have their social media platforms up there. Give it a break. Could you please just give it a break for 2 weeks and see if we can all work together? And if we're all working together, you're going to be surprised how much good that we can do. We've got frontline hospital workers here, doctors, nurses, EMTs, that are putting their lives on the line every day for us. And it's too much to wear a mask. You're going to get criticized for asking people to wear a mask. That's not acceptable for me. So I'm telling you, we got 2 weeks. That's it. I'm not going to come back in 2 weeks and say I'm going to give you another chance, because I'm not giving you another chance.
My question was more to the point of why aren't you taking stronger action now? Why don't you order people to wear masks?
Well, the reason we're taking such strong action now is I see the number of cases, the hospitalization, the infection rate going up at such an alarming rate. I see that when we're bumping up to 900, I think, on hospitalizations, and we've got, we're averaging 1,300 positives a day. 1,300. That's 4 times what it was, 6 weeks ago. I mean, we can't keep going. If it goes up 4 times more, we're in a world of hurt. So the alarm right now is because the infections have gone up, the hospitalizations have gone up, the fatalities will follow and go up. That's just inevitable. And I want everyone to understand just how important this is, that you wear a mask at all times. Someone comes to visit your house and they don't have a mask on, tell them to put one on. Tell them to, put one on to protect themselves and to protect you. I mean, that's what we have to start doing. And you need to be thinking of other people. Don't just think of yourself. Think of your family. Think of these frontline workers. Think of a doctor who lost his father because people won't follow protocols. And if we don't improve this, it's going to be on those folks that don't cooperate for the reason this infection rate continues to climb. Because I'm telling you, the vast majority of Nevadans are doing a good job. It's the outliers that aren't doing a good job, and they're the ones that are going to own this. They're going to have to live with the fatalities and the infections that we have. I talk to people that are that are hospitalized. It's not easy. So please help us.
I'm going to steal one more question. The federal government is withholding distribution of rapid COVID tests from several states, including Nevada, saying that we haven't used the tests that we have. Do you have a comment on that? Is that
Yeah, it's my understanding from my briefing on that what we had is a problem of the distribution, that the federal government put in some criteria for the licensure of those people that distribute those tests, and we can't distribute them without those folks having that licensure, and they don't have it. So we're working to get more licensed folks available to distribute those tests.
Okay, thank you.
You bet.
So these restrictions, the 2 people in meetings, those are part of directive, correct? Not recommendations, is that correct?
This is not a directive.
Okay.
This is a personal impassioned plea for people to please step up and do these things. Now, a lot of these are in place already. Businesses have to have protocols in place. They have to have masks. They have to have social distancing. Our universities and colleges need to do more. I'm asking our airports, you have to wear a mask in the airport now. It's just not being enforced as much, and we need to do better. We need to do better.
14 days from now, you don't see a change. What kind of restrictions are you looking at in regards to business? Are you looking at full shutdowns, or is it something that you're more looking at further restrictions?
I don't want to speculate what we'll do in 14 days. It's going to depend on what our rate is at that time as compared to now, if we've made any impact at all, if it's starting to come down or not. And it's going to have to be severe in order for us to get a handle on this. Now, it's just a question of how much we're going to have to get a handle on, what position we're going to be in 14 days. You saw when we had the shutdowns, the cases came down. I don't want to do that again. I don't want to do that again. Anybody's got any questions for Dr. Sloan? I'm here.
Hi, Governor. So today you're asking local governments to step up and coordinate efforts. I'm wondering, a few months in, does this devolve decision-making strategy, leaving it to counties to submit mitigation plans to a state task force rather than using more statewide measures? Do you think it's the optimal strategy still?
I do think it's the optimal strategy. We do not have enough resources at the state level. We have OSHA, Business and Industry, that's going out, and they're doing a lot of enforcement. Some of it's a little higher profile. You see it because the fines are a lot larger. But we can't go into every county and every city and every township and walk into grocery stores and restaurants and whatnot. They have these folks who are allocated resources through the CARES Act money to enforce the protocols and the directives, and I'm calling upon them right now to start. The 14 days starts now. It starts right now. So I'm asking them to get out in the communities and to do something. I saw a comment before I walked up here from Mayor Sheevy in Reno that said that she's going to start enforcing the mask mandate. She's going to start visiting more businesses. I'm asking every single jurisdiction to do that. Everyone.
Is there any evidence that the OSHA fines you just mentioned, is there any evidence that they're working to any sort of mitigation end?
Well, I think they're working for the people that are getting fined, and then I think what happens is other people see that if you break the rules, if you have too big a gathering, if you don't have people doing social distancing, if they're in a big group or they're not wearing their masks, I better get my act together or I'm going to get fined.
So we still think it's a deterrent?
Pardon me?
We still think it's a deterrent?
I do believe it's a deterrent. I absolutely do, but we need to do more to make it even more of a deterrent.
Thank you.
We'll do last question from Ryan.
So, Governor, I'm hoping you can clarify. You're using the phrase stay at home 2.0. You're asking people to stay at home as much as possible. Do you want people from out of state to stop coming to Nevada? Is there a line there that you want to draw in terms of out of state tourism or people coming over from California to visit Vegas for a weekend? Should they not come over these next 14 days?
No, they certainly should come because those are protecting our jobs. But when they come here and they're staying in one of our properties, they need to wear a mask. When they're in one of our restaurants, the restaurant has protocols in place that they have to follow, and both the employers, employees, and the guests have to follow. I'm asking if they're going to have a drink, if they're going to play cards or a slot machine, whatever it might be, wear a mask. That's what I'm asking for. I'm not implementing any new restrictions right now. I'm encouraging them to come, but I'm encouraging them to please follow the rules. And if everybody would just pitch in, and I mean this from the bottom of my heart, I mean, I know people are going to complain that I'm asking for more cooperation. I know people are going to complain about asking for more enforcement. I know some of the social media people are going to find a way to criticize what we're saying. Can you please just give it a chance for 2 weeks? Can we please try to get this under control for 2 weeks? I'm not saying you got to do this until March, which is an unreasonable amount of time to most people. I'm saying for 14 days, can everybody please pitch in and see how much good we can do? And I think it's going to have an enormous impact.
Great. Thank you, Governor.
Thank you. Anybody have any questions for Dr. Slonim on the medical side?
We talked last week about, or not last week, last press conference about worst case scenario in hospitals. This might be a hospital association question, but for now, how close are we to the worst case scenario, i.e. no visitors, beds in hallways? Is that something that is on the horizon for now?
Yeah, at the moment it's not, and we hope that we've learned a whole bunch of things across the last 6 to 8 months that allow us to address some of those issues. But I don't take opening a parking garage and putting hospitalized patients in it lightly. And that's where we are likely this week, which is why it's one of the reasons why I'm speaking out now. We need the help of the community if we're going to be able to stave off anything worsening from this pandemic. We're putting our healthcare workers at risk, we're putting each other at risk. We've got to do better.
Doctor, did I understand you that are we now using that the emergency ward that you built over in the parking lot?
We're not using it yet. I expect.
But you're on the edge of using it?
We're on the edge of using it.
Okay.
Thank you.
Thanks, everybody.